Lovelies, once again I take this opportunity to welcome you back to the Nursing Moms YouTube channel. I'm Nurse Janet, and in this video here today I'm going to talk about miscarriages. I'll cover what is it, what causes miscarriage, what are the signs and symptoms, what are the types. Yeah, we have different types of miscarriages, and lastly, how can you prevent? Is it preventable? How can you prevent miscarriage? Stay tuned. Miscarriage is loss of pregnancy before 20 weeks gestation, and medically it's called spontaneous abortion. Yeah, that is another name of miscarriage. Most miscarriages occur in the first trimester, and again, about 15 to 20% of these pregnancies always end up in miscarriage. The risk to miscarry increases with age. This means that in early 20s or even your teens, if you conceive around that time, the risk to miscarry is always low compared to conceiving from your late 30s, 40s onwards for different reasons that I'll mention. And let's now move to types of miscarriages. We have different types of miscarriages, and to begin with, we have what we call missed miscarriage. In missed miscarriage, you've lost the pregnancy, but your body is not showing symptoms of pregnancy loss. You are not bleeding, you are not cramping. You are just okay, but there is no symptoms of pregnancy in you, and there is no symptoms of pregnancy loss. You are currently not vomiting. All the signs of pregnancy that you had have stopped. I think for once you've heard of someone complaining that she went to do an ultrasound and was told that the fetus has no heartbeat. Yeah, this is what happens in that situation. The fetus is dead, but your body is not showing some symptoms that you've lost the pregnancy. So in later weeks, you'll start experiencing some brownish discharge, and this is what will trigger you to go to the hospital. The second one is complete miscarriage. Just as the name says, you've completely lost the pregnancy, bleeding occurred, cramping occurred, and you've passed the fetal tissues here. And the third one, we have incomplete miscarriage. In this one, you've not completely expelled the fetal tissues. Yeah, some part of the fetal tissues or even the placenta is retained inside you. Threatened miscarriage. In this, there is bleeding, though the cervix is closed. Actually, it really wanted to get out, but thanks be to God, the cervix is closed. You will be experiencing mild cramping and bleeding. And in this, the pregnancy can continue very normal, though it requires close monitoring. You will be advised on bed rest and avoiding strenuous activities. Recurrent miscarriage, this is also known as habitual miscarriage. Actually, it's one of the very unfortunate and painful situations because it shows that you've had at least 3 consecutive miscarriages before. Inevitable miscarriage, just as the name says it, it's something that is unavoidable. You are cramping, the cervix is opening, you are bleeding, the amniotic fluid is leaking, and most likely you are going to expel the fetus and everything, all the products of conception. Most likely this is what leads to complete miscarriage. Now let's move to the signs and symptoms of a miscarriage. These are the signs and symptoms that if you've seen, you should be worried. Number 1 is bleeding. This bleeding is a bit progressive from spotting, light bleeding, or even to heavy bleeding. The second one is abdominal cramping. If you also have abdominal pains, you can have fevers, chills, or any other sign of infection. And again, if you experience decrease in pregnancy symptoms or no pregnancy symptoms at all, previously you used to vomit, you had food aversions, you had breast tenderness, you had bloating or even increased urination, but all of a sudden you've realized that these symptoms are no longer there, you should really be worried because if the pregnancy is carrying on smoothly or progressing well, the level of HCG hormone is always also progressing very well, and this is what brings about these changes in the body that we always experience during pregnancy. So when there is a loss of pregnancy, the pregnancy hormones too will be reduced. Now let's move to the causes of miscarriages. Most of the time, women blame themselves for pregnancy loss, but this is not true. Most of miscarriages occur due to reasons that are far much beyond our control. The most common cause of miscarriage is what we call chromosomal abnormalities. This is a problem with the number of chromosomes. It can be either extra or even less, and it occurs in the early stages of fetal development. The second one, we can have what we call blighted ovum. In this, an embryo never formed, so this kind of pregnancy cannot continue. Other causes of miscarriage include abnormal placenta development, weakened cervix, abnormally shaped womb, food poisoning, certain drugs, hormonal imbalance, infections, and ectopic pregnancy, that is improper implantation. Apart from that, the general health condition of the mother also determines the outcome of a pregnancy. If the mother has weak immunity or is even suffering from the following conditions, then there is high chances of losing pregnancy. The tough question of whether miscarriages can be prevented. Can we prevent a miscarriage? Actually, the answer is it's very difficult to prevent a miscarriage because most of the causes of miscarriage are things that are far much beyond our control. And most of the time, women come to the hospital when a pregnancy has already been lost. And you can as well lose a pregnancy without even knowing. The case of a missed miscarriage. You lost it some weeks back and you really don't know whether you lost it. So the causes that lead to miscarriage are things that are not preventable. Any prevention starts with a cause. And the causes that I've read previously, they are things far much beyond our control. However, things that can be done is having early prenatal care. Be in a healthy condition, maintaining healthy weight, eating proper healthy diet. This can help, and most importantly, avoiding over-the-counter drugs. Over-the-counter drugs can also lead to a miscarriage. Yeah, some drug and food poisoning. There is some foods that you should also avoid during pregnancy. That is all that can be done during early pregnancy to prevent, maybe with some percentage to prevent the loss. And again, try as much as you can to take your prenatal vitamins in time. The early weeks is very, very important. The first one is maternal age. If you are conceiving in your 40s onwards, then there is high chances of you getting a miscarriage compared to someone who conceived in her 20s downwards. And again, if you've had previous miscarriage, you are at a higher risk of getting a miscarriage compared to someone who has never had a miscarriage. Maternal weight, if you are malnourished, like underweight or obese, these two puts you at a higher risk of getting a miscarriage. Your health condition, actually, for you to have a successful, smooth pregnancy, then you really need to be healthy. Stay healthy and eat healthy and live healthy. Yeah. How soon will it take to conceive after miscarriage? Resuming your normal menstrual cycle life after miscarriage doesn't really take long. It can take 2 weeks to 1 month. So the time that you want to take really depends with you. After you've healed both physically and emotionally, then you are set to go ahead and conceive after miscarriage. There is no harm, and again, it's not certain that if you've lost this pregnancy, the subsequent pregnancy too will be lost. You should really not be scared. However, you should be too close to your doctor. Start the early antenatal cares as soon as you confirm that you are pregnant. There is some myths that I want to debunk about miscarriages. Yeah. Some people believe that having sexual intercourse in early pregnancy can lead to a miscarriage. This is not the truth. This is very, very false. It's wrong. Yeah, so if you've been believing that having sex in pregnancy can lead to a miscarriage, then today, Nurse Janet want to tell you that that is not the correct thing. Unless told by the doctor to restrict from sexual intercourse, sexual intercourse is very, very much safe and of great benefit to your pregnancy. So in some situations, the doctor will tell you, like if you've had a threatened abortion, then you will be restricted from having sex. But again, it can never cause miscarriage in a normal pregnancy. Another myth that is there is that loss of pregnancy or miscarriage always occur due to reasons like you didn't take care of yourself. This is not true. Miscarriages are not really preventable. It's not your fault to have miscarried this baby. It's never your fault. It's never a woman's fault to lose a pregnancy. It's not that you are not taking care of yourself. Another myth is that if you've conceived while on a contraceptive, then you will end up losing this pregnancy. This too is another myth that is not true. If you've conceived while on contraceptive, your pregnancy will carry on smoothly to term. It has no effect or it can never lead to a miscarriage. Thank you for watching this and engage me in the comment section. You can as well subscribe to the Nursing Moms so that we grow together as a family. Bye.